Hello and good afternoon. Thank you for joining us today for the Self-Advocacy in Rare Disease. My name is Krista Comfort and I will be your moderator today. I have NF1 with plexiform neurofibroma, optic bilateral gliomas, and I live here in San Antonio. I would now like to introduce you to our panelists.
I'm Carole Mitchell. I'm the nurse coordinator of the NF Center at NYU. I have been in my role for 13 years. And it has been a delight to be here and enjoy all your company and help everyone through this process.
Hi, my name is Selogic. I'm a licensed social worker from the state of Ohio. I work in care and outreach with NF Midwest, and we service 6 Midwest states. Thank you.
Hi, my name is Christine, and I have NF2. I'm an NF2 patient, and you probably saw my face last night on the big screen, but here's my whole body.
I'm Jennifer Ching. I actually am staffed at the Children's Tumor Foundation. I met a lot of you yesterday as I was working the SWAG area. I'm super excited to be here. I actually am the director of HR at the Children's Tumor Foundation. I'm super excited to be here today.
Thank you all. And we will have a Q&A at the end of the panel, so please make sure to save your questions. Our first set of questions will pertain to advocating for yourself in regards to insurance. So Carole, would you kick us off with what should someone with NF look for in insurance plans, especially for a young person transitioning off of their parents' plan?
So I am going to actually defer that a little bit because I'm a nurse and I don't know a lot about insurance plans. But I think that, who takes that?
I can pick that up.
Okay, thank you.
So when you're first employed, I think that the best person that you should probably speak to would be the HR department. So whether there's a manager or coordinator, a lot of companies also have PEOs, so they can also be an advocate for you, just depending on the organization that you're working for. So HR is someone you definitely should build a relationship with in regards to learning insurance and the ins and outs of it.
And I can add to that a little bit. I would say shop around. Don't be afraid to contact different insurance companies. I think it's really important if you ask them or tell them, here's a list of my doctors. Can you tell me if they're in network? Are they out of network? What is my deductible? What is my co-insurance? And learn what all those terms mean to you, because at the end of the day, that means money out of your pocket. I would also like to ask if they cover or what they call step therapy. So meaning, like, am I gonna have to start at a cheaper tier of medication before my current medication could be approved? And don't be afraid to reach out to pharmaceutical companies. If you already are on a medication, you could always call and you could ask them, do you have companies that you know cover your medication? They will probably not advise you on what company to go with, but they pretty much know who covers their medication. So,
Thank you both. And I would also like to share from my personal experience, it's so important to know the fine print in your insurance policy. Really read your policy documents. For example, in my last position and with my last employer, I had a copay of $100 for my MRIs. However, if I called my insurance provider in advance, that copay would be waived. And it saves hundreds of dollars if you're having multiple MRIs a year. So our next set of questions pertains to the clinic. What does it look like to speak up and be listened to in the clinic?
That one I can answer. So we have a comprehensive center at NYU, and one of the most important pieces of your intake is answering questions, asking us questions. We want to hear your story. No one can tell us more about you than you. So we encourage patients to dialogue with us. If you have some issues that are worrisome, we want you to, make a list before you come in. If you think you might get nervous and forget, but it's important at every clinic to make sure you have a voice and that you come in with what you have to be comfortable speaking with your clinicians.
Thank you so much.
And
Christine, I would love to
think
hear.
that on that,
Christine's
as
gonna
a
jump.
patient, Carole can be my witness here that I've been a little louder than just a patient advocate. I went through my hormonal teenage years, unfortunately, and it was bad. But in any case, I think it's really important if you want to feel comfortable. And with my doctors, I jokingly say I'm their boss because as a patient, you don't want to go to an appointment feeling like you're the underdog. You want to feel like you have control of the appointment. You have power to make a decision. And you also have, surgery. If you don't want surgery, don't have surgery. But sometimes there's choices that you need to make, and doctors there to guide you, but not necessarily make the decision for you. So I think it's just super important to make sure that you stay in control. Be the boss.
Absolutely, Christine. As a patient also with NF, I found that if I'm not getting the answers I'm looking for, it's okay to seek out a second opinion. You know your body best, and you know yourself best, and you know what's best for you. Okay, our next question is, how can someone make sure they're getting the most out of a first-time clinic visit? Carole, I feel like you might be an expert for that one.
So it's going to kind of be redundant for me to say this too. At our clinic, we start with a phone interview, and I call with a set of questions, and I ask patients, the first one is, what brought you to us? Just to get a feel for what the patient is going through and why they want to be seen at a comprehensive NF center. What's going on? And I spend about 20 minutes at least on the phone with a new patient and have these conversations just to say, this is what I would like you to bring. If you have these records, I give a list of things. I follow it up with an email at the end. But first time in a clinic, you want to come in with questions you have, stories about yourself, anything you want to share with us. We want to know you not as a patient, but also as a person, because we celebrate all your wins and all your sadness. We are part of a team, and that's what should be at any doctor visit you go to, even your primary care. It should be someone you feel comfortable with and someone who makes you feel comfortable, that you can say anything. Christine is right. She did go through a very rough hormonal teenage years, and we were part of that. But we've become very good friends, and she's apologized for it, but it was not her fault. We all went through that. So, but she never felt like we weren't listening to her. She knew we were, and I think that's why she's still part of our team.
No,
Yeah.
you guys are definitely always listening. I'm making sure that
We are listening. And doctors should be listening, and nurses should be listening. And if anyone ever feels like they're brushing you off, that's not the place for you. And don't be afraid to seek someone else. It's okay. It's the right thing.
Do you feel the circumstances are any different in the telehealth setting?
We go back and forth on telehealth, and it's kind of interesting for us as clinicians to see patients in their own setting, because they come to a clinic and they're in an exam room, and it's an artificial, sterile environment, and you don't get to see people. But in video visits, we see them in their home, and they're automatically more relaxed, and you can see there's like dogs running through, and there's things going on, and you see people as more people, more like not a patient. So I think that there are times when you actually need a face-to-face conversation, and you need a face-to-face exam, so that you can actually look at things and say, show me this, let me see that, let me take a picture. And telehealth doesn't give us that clarity for an exam, a descriptive exam, but it's very convenient for people. But it shouldn't be the only thing.
You're absolutely right. In applying for disability, what tips and tricks should someone be aware of?
Yeah, so I think number one, I think people sometimes think, I have a diagnosis of this, I should be approved. But honestly, what it is that they look more at symptoms that are a cause of a diagnosis. So for example, you could have two people who have MS work on the same job, doing the same task, apply for disability, one gets approved, one doesn't. Well, what's the difference? The application. So in one application, they probably focused more on presenting the symptoms and having all of the information in the application ready to go. So the more complete you have this application, the better your chances. So that means getting dates together of important tests, dates of diagnosis, dates that symptoms start, and also look at the application before you start to put in the information, because the more familiar you are and the more take time and do maybe a section at a time or a section a day, because that's going to give you the clarity to make sure you're not missing anything. Also, don't wait to apply. You do not need a lawyer to apply for disability. So the first two steps, no one's gonna really see you face to face. They're seeing you as an application. You're just another application in thousands. So you really wanna plead your case, just make sure all your information is in. You most likely will get a denial. That's just the honest truth of it. There's an influx of people applying. It's just how it goes. So you don't need a lawyer for that first initial application. You don't need a lawyer when you decide to appeal. By the time you appeal, you probably will want to start looking for a lawyer, because that means the next step could be a hearing. And that's when you finally get face to face. A lot of people say, well, I don't have money for a lawyer. That's okay. You can search around. Social Security has a list. They can provide you. A lot of times you can have contracts with this lawyer where they don't get paid unless you win, and they will take their money out of back pay if you're approved. Also, if you're a senior or you're helping someone who is a senior, call your senior service department where you live. A lot of times there's income-based payment plans with a local lawyer in that area, and they can work something out with you. Sometimes it's next to no cost. So always appeal, don't reapply, because they could go back and back pay from the date that they deemed you with a disability.
Thank you, Sarah. Did anyone have anything to add to that? Okay, great. So the next question I have is in regards to the workplace. What does it look like to speak up for yourself and be listened to in the workspace?
I'll take that one. So I think the most important thing is to make sure that, like I said, is make sure you speak to your manager or your boss in regards to the things that you need for yourself. So whether it be an accommodation at work, or even if you needed time off. So in addition to PTO or vacation, sick, personal days, you are entitled to FMLA if you work at an organization where there are 50 or more employees within a 75-mile radius. You're entitled to 12 weeks off per year of time. So some of that can be paid, some of it can be unpaid, because you can loop your own time into that 12 weeks. But make sure that you're aware of that, and you can work, like I said, with your HR department in regards to taking FMLA if you need. The FMLA and ADA information is also in the app. I sent over all of those links. So these are federal regulations that you should all be able to access pretty easily. And like I said, it's all the information's in the app.
If I can just add one piece to that, thank you.
Yeah.
FMLA is the Family Medical Leave Act, and it entitles everyone to 12 weeks off. But people get worried about that because they think, well, I don't need 12 weeks off, but maybe I have a child who needs to see an eye doctor every 6 months or a neurologist so you can have it made so that you're taking off 1 to 2 days a month, but you're actually filling out this form, which gives you the legal power to say to your employer, I have a sick child or I'm sick and I need these appointment dates and I don't want to be penalized as an employee with sick days or time off. So just don't think because it's a 12-week block, it has to be used in one fell swoop. It can be over the whole year. Break it up however you need it, which is very nice. And we fill them out all the time. Don't be afraid to come to your clinic and say, listen, I don't know how I'm going to do this with work. I don't know how I can make all these appointments. We'll help you with that. We'll help fill out a FMLA for you. You get it from HR, but you can bring it to the clinic, and the clinicians will help you do that. Nurses in the office will.
Right, so you do need a doctor's note in regards to the approval of FMLA, and it is nice that you can take it intermittently, so you can take it in hours or days. So like she said, yes, thank you.
Yeah.
I'm so glad you both mentioned that, because when I was on my clinical trial for a few years between 2008 and 2020, I was having to be out periodically for doctor's appointments. I traveled out of state from the Houston area to Alabama. And so not only was I going to the doctor once every month initially for a period of 2 days until those appointments spread out more, I was also having side effects from the medication and was having to miss work. And so my employer, I work for MD Anderson Cancer Center, great organization. My boss was very, very flexible with me, but she also connected me to my HR department, and they were able to get me FMLA intermittent leave. And it was a saving grace, and it protected me in the workplace, but also allowed me to go to the doctor when I needed to.
Mm-hmm.
Okay, I think Christine will be great at answering this question. What about higher education? What does self-advocacy look like there?
Well, I had an experience last year where I had to work with a graduate school and really rebuild their system, because most of the answers I was receiving were other people have done it, other deaf people have passed through this, and I said to them, guess what, everyone's different. And I remember the most important thing is to reach out to whoever is in charge of disability at the school, whether it's a dean of disability or just a representative staff member. Reach out to them, tell them what you need. Again, I'm not afraid to tell people what I need. So you really just want to talk to them, and accommodations are really crucial. Making sure you have the right accommodations. If you need more, you can always ask for another accommodation. It's usually just with an email. And on a different note, somewhat, I think if you have problems with the way they're doing things, for example, I had problems with the way they were providing CART, and I remember sitting on a 3-hour Zoom call with the dean of practically every department you can think of. And it's not easy to change things and to speak up. It's not something where you just talk and speak up. You have to do the work as well. You have to reach out to the right contacts. You have to talk to your professors. That's key, talking to your professors. They are the ones in charge of class. And I know my professor for one of my classes, she said to me, I never had a deaf student, but let's go for it. You tell me what you need. If something needs to change, I'll change it. And I remember the first day of class, we were having trouble setting up CART. And I said to my professor, you know what, you can just, this once go and I'll catch up later. She said, no, I'm not going to leave you behind. Every student deserves to learn. And I thought that was really, really important. It made me feel secure. In the same way you should feel comfortable in a doctor's office, you should feel comfortable in a safe environment so you can learn. You shouldn't ever feel like you aren't equipped with the right tools to learn. That's crucial. And so, first person, talk to your professor. They'll guide you.
Thank you so
Yeah,
much.
I mean, I just think that was excellent. Thank you, Christine.
Thank you so much. Thank you, Christine. So So we've covered a variety of topics today. I think one thing I would love to hear more about from our panelists is share one thing that you would want everyone here today to know about your spot in the advocacy world.
I'll start. I'm an RN, and I have been a nurse at NYU. It'll be 37 years in July. And one of the things I got to do was work in the operating room with surgeons. And if you didn't stand up for yourself at times, and you got rolled over. And so I learned how to stand up for myself early on in my career to say that my voice is as important as anyone else's. And I think that as patients, there's sometimes this tip where patients for physicians or patients in clinics where they don't feel as important or as empowered, and that's a mistake. And the clinics that don't empower their patients are making a mistake. But you need to go in with the expectation that your voice is a voice that should be heard. The time that you have an appointment, the time spent in that appointment is about you. And that's the only way we can help you is if you tell us what you need and what's going on, and be very upfront. Don't hold anything back. It's very private. Nothing will go outside. But you need to be able to have an open and committed relationship and conversation with your physician or your nurse in the practice.
Thank you.
My turn. Be okay with not knowing everything is what I have learned. I learn from every patient, every member that I've ever come across as much as they have learned from me. And I think that's what advocacy is about. It's a partnership, learning and being a team on how to maneuver things that come up. And so for me, that's the biggest thing is every day I still learn something new. And I hope that I'm teaching others just as much. So.
And I just want to add to that, ask questions. That's how you learn. Ask 100 questions. I mean, just keep asking them. You'll eventually get the information that you need or you want.
Thank you all. How has having to advocate taught you something about yourself? What advice would you give to someone who is struggling with this?
I would say don't be afraid. Fear is one of the things that keeps us trapped. Don't be afraid. Whatever you think you need to do in your private mind and your thinking at home, bring that outside. Never be afraid to be yourself and to express yourself. And just don't stop. Don't stop.
If I can just add, I think it's important to realize that having fear, being fearful, and being strong, they're not the same thing. You can be strong, and my mom once told me when I was told I needed brain surgery, number one, I was crying, and I just said, I can't cry, I'm tougher than this. And my mom said to me, it's okay to cry. And you don't always have to cry, but it's okay to be scared or be surprised. It's totally normal. I hate that word usually, but if you feel it, it doesn't mean anything against you as a solid rock. I'm really, really strong, I'd say.
Yes.
And I cry every time I'm in the hospital for some reason or another. So there's no reason that you shouldn't feel like you can't let out your emotions.
Good advice.
That's great advice. Thank you, Christine. Does anyone have anything else to add?
I think be okay with thinking outside of the box. When there's a will, there's a way, as they say, and sometimes that's just being creative. I've had members have come to me and like, oh, I can't afford medication. Like, okay, let's figure this out. What are other ways we can be creative with the money so that we free up a certain amount to put towards medication? There was insurance denials that I have helped work with before, and we're brainstorming like, If we could just get your physician to talk to the insurance company, we thought we had this great, wonderful idea. And we said, why not try it? Call the insurance company. And we said, this is what we want to do. We think if you could just talk to the physician, you would understand why we need the test. Little did we know, there's a program. It's called peer-to-peer review, and where your doctor will talk to a physician who's employed by the insurance company. And a lot of times, the denial is overturned. But if we weren't thinking outside of the box, we would have never thought to even call the insurance company and be like, oh, we have this big idea. Well, we were creative, but thank goodness someone else had already thought of it, and we were able to handle a situation that could have been devastating otherwise.
I was going to say 100% that happens all the time in our clinic, is people are denied an MRI, and the patient hears about it before we hear about it. And the patients, they cancel the appointment because I was denied. And we always say, oh, no, you need to let us know that happens. Don't ever accept something. If we asked for you to get an MRI or a blood test or any other thing, physical therapy, and it was denied, come back to us, because we can do a peer-to-peer. It's very commonplace. And having a doctor talk to the medical director in the insurance plan, they can talk together, and it usually is overturned. So if you ever get denied anything, let your clinic know. Let the doctor who ordered whatever that was know. We can often get that. Just don't buy that it's denied. That's not enough. Let us know.
That goes for prescriptions also, definitely.
Right.
If I could just add something as a patient, my insurance denied the current medication I'm on for retinue, I think 4 times. And finally, my doctor, Dr. Yohei, who is very smart and thinks out of the box, decided to contact the drug company directly. So I actually received my medication from the drug company. They call me every month and ask me when to send it. And it worked. I was able to get around the problem, move on.
The red tape.
There's always a lot of red tape, unfortunately. You have a lot of patience when you're an NF patient.
That's true.
And on my end, I would share that, if you find yourself wanting to be a part of research studies, go to clinicaltrials.gov. There is a ton of research being done on neurofibromatosis that was not there even 5-10 years ago. That's how I found the trial I was a part of. You can reach out to the investigators directly and find out what the eligibility criteria is, if there's any travel requirements, and they'll be happy to give you that information. In addition to that, I would say self-advocacy has really helped me find community and resources I never knew were out there by getting involved with Cupid's Undie Run, the Texas NF Foundation. I've met so many lifelong friends that I never would have met otherwise. I used to feel so isolated having NF, and being involved with those activities and putting myself out there has given me community I never knew I had, and I know I'm not alone anymore.
Beautiful.
I think, does anyone have anything else? Okay, I guess we'll open it up to questions.
Thank you all. We have a lot of questions in the app, so I'll get us started with one of those, and then we'll go around the room. For Krista and Christine, what can and should you advocate for in your personal life? If you could share anything about that. We talked about work, we talked about school.
Oh, wow. That's a great question.
Well, I think it's important, let's start at the family baseline. I think it's important to advocate to your parents or siblings what you need help with, how you want to be treated. I told my brothers, don't treat me like a fragile glass, and when I have my down moments, and just don't treat me like I'm this fragile being. Make sure, they then, make fun of me and wrestle with me, but they are also really supportive. So I think starting at that level, then making sure for me as a 24-year-old socially, really being upfront and just saying, listen, I need you to do it this way. I need you to talk into the tablet. And to be honest, all my friends, they're like, okay, and just move on. They don't think of me any differently.
I'm glad you said that. You know, I found when I got comfortable talking about having neurofibromatosis, it wasn't until I was later in life, like in my 20s, I realized that I had a bigger support system than I was aware of. And I mean, those friends, you know, got rallied behind me when I went through my clinical trial, when I organized different fundraisers, and they've really accepted me and my condition, and they're always asking and advocating for me when they see I'm like posting on social media that, you know, I got denied for a medication. They're like, what can I do, Krista? So I think it's important to be somewhat vulnerable because you never know what support you may get.
And just to add also that for outside, everyone deserves respect. And you should always treat each other and have the expectation that they will treat you with respect. Don't settle for less.
Okay.
I don't actually have a question. I just wanted to add a comment. First of all, that was wonderful. Thank you all so much. But one thing that I wanted to add that wasn't touched on was advocating in a larger sphere. So for example, peer-to-peer or the prior authorization process, you're a voice in your government as well. Everyone who lives in the United States has a representative of their district in the state government, in the US government. And there are bills sometimes that come to the floor of the Congress or of your state Congress, things about reforming prior authorization, of changing the peer-to-peer law. So if there are things that are affecting you that are on a bigger scale than your individual clinic, don't hesitate to call your congressperson, rally on the Hill, go to national events where you can advocate for rare diseases, for research money for rare diseases, for changing the prior authorization and insurance process to be fairer to patients. You have a very strong voice as a patient, and the voices of patients and families in the national government sphere is what often gets things done. So use it.
So my question is, how do you deal with difficult employers? I have an employer that just recently got a person in HR for the first time in over, I want to say 5 years. They have very limited knowledge, and specifically in our handbook it lists like FMLA is a last effort, like we don't want to do FMLA, and the hoops for reasonable accommodations are very large. They don't want to do reasonable accommodations. If you ask for things, they're like, oh, we'll just do it, we won't document it. What are your tips for advocating for yourself better when there's that type of situation?
So I think knowing the laws also, but are you in an organization where there's 50 or more employees there?
Yes.
You are. So legally, they cannot refuse FMLA to you. It is the law. So I think that's where you need to start. Advocate for yourself. Go in there and say, these are my rights. And if you go in with the doctor's accommodation, they have to give it to you.
This is in part a comment and part a question, but segueing on what you said about using your own voice, no doesn't mean no with insurance companies. And even after it's gone to a peer-to-peer review and the answer's still no, that's still not the end of the story, because the patient has the right to file their own appeal in nearly every insurance program in the country. And sometimes the patient's voice and the patient's appeal has more weight than the professional appeals. And I personally have had that happen several times where my provider couldn't get it approved, but I did. But you have to not give up, and you have to know how to do it. I'm wondering if I see some of you shaking your heads. Could you talk a little bit about your experiences with that and about how patients have that right to file their own appeal?
Go ahead.
Yeah, so I've helped several people across the board, different populations that I've serviced, and you're 100% right. When you appeal, it is so important to be able to tell your story. In fact, the Patient Advocacy Foundation has a wonderful training on their website. If you haven't checked it out, it kind of gives you step-by-step training on how to appeal, what a letter would look like, how to advocate for yourself. And sometimes it just takes even a statement in that appeal letter for to touch someone's heart, to be like, okay, I need to look further into this. So thank you for bringing that up, because it is so important. You're just pleading your case that I'm a human and I need help, and this test or medication, whatever it's gonna be, could help me, could change my situation. So don't get discouraged. Definitely advocate for yourself. Don't be afraid to speak out, and have people read over your appeal. Because a lot of times we get so in this cloud and we feel like we got to say this, we got to say that. Well, when you're in that kind of state, you end up forgetting things just out of frustration. So have someone else look at it, because sometimes people outside of the storm could see more clearly and be like, you're forgetting an important thing. I want you to say this and add that. So yeah, if you haven't checked out the training, Patient Advocacy Foundation, definitely check it out. There's also training on how to apply for disability, which is very helpful.
And then just to add to that, and to your question, sometimes when we make phone calls now, you get someone who maybe is distracted, or maybe it's not even a person. You're talking, online. You only get somebody online to put your thing in. Just keep asking for a person. You want to talk to a person, and if a person doesn't give you the answer you think you deserve, say, can I speak to your boss? Can I speak to your supervisor? And just go up the chain. And you'll, at some point, will get a sympathetic ear, and that's all it really takes, is to get somebody who listens to you and hears it and says, you know what, let me try something on their end. But that's what I'd say. Always go for speaking with a person. If you get no from the first one, then you want to talk to their supervisor, and you want to just keep going up the chain and really be dogged about it. Continue on, don't give up, and go for it. Fight this way through, because you ultimately will get what you want. It's just that sometimes it takes more work than other times. But don't stop. Just keep going up the chain.
I would also like to add, it's kind of that old saying that you get more bees with honey. Advocating for yourself and being strong doesn't always mean you have to talk in a negative tone. So a lot of times when I call someone, I will notice, if it's on phone, I'll notice their accent. Oh my gosh, I love your accent. How are you doing? All it takes is to make a common thread for people to feel more accommodating, more wanting to help you.
More relatable.
Yes. And so definitely pay attention to the language. You can be strong, but be civil.
Yeah, it's true. You have a question over there?
Yes, let's get you.
We're talking about self-advocacy. How do you teach children self-advocacy? I don't have one. My son has, and I understand I'm not always going to be there. He's going to have to go to school and go places on his own, soon going to middle school by himself, and I want him to be able to advocate and not just accept, no, or you don't, he went to school one time and they told him, no, you don't have a headache. No, that's not bothering you. And I'm like, how do you tell a child that? So I'm just asking, for children, how do you get them to advocate for themselves when their parents or their caregivers are not there?
So I'm just going to start that simply. It's about building confidence in your child. Children need to feel secure and feel safe in their home, and then to be able to grow as a person. But it's teaching your child that they're important, that they have a voice, that they're a good person. Building confidence starts very early, and that's parents and in the home that starts, where you start building your child up and saying, that was very good, you did that so well, you're going to be great, and just build that up so that they can stand up to themselves. Just start early for that, with that kind of talk in the house, that positive self-talk.
I would agree with that. As a child with NF, I was the only one in my family with NF. My parents still treated me the same as my other siblings. They didn't treat me as if I was sick. They had me involved in all kinds of activities, from soccer to cheerleading to softball. I was never very good, but they still, made sure that if there was something I wanted to do, that we did it because they wanted me to learn how to be around other people, to be okay with looking different, and to just have like friends. And so they also, on the catch side of this, would be talking to my coaches, would be talking to the school nurse, saying Krista has neurofibromatosis. There might be times where she can't do backflips, but just please keep an eye out for her. If she says she's feeling sick, please call us, tell us. Like, they were doing all that on the back end to make sure that I got the care and support I needed from those coaches and the school nurse.
If I can add on to that, this is, I was bullied in school for years and years, and this is when I wasn't really confident with telling others about NF2, but I think for me, having a role model to look up to and see that eventually they're going to, if I follow their steps, I will be able to have friends in a comfortable environment. So I think it's also important to find someone, I'm not saying it's easy, but a role model, someone a couple of years older that faced similar situations socially, and allow your son to just be exposed to that and go out to a movie with them, or just get to know them.
How did you find your role model, Christine?
How did I find my well, sorry, it's slow.
Sorry.
Well, I'm really into academics. And so for me, my role models actually, they were quite a few years older than me. They were my teachers. And just seeing that they were really confident about teaching, and they were also confident, they were comfortable to make me comfortable. And that was a big thing, that they felt strong enough and powerful enough that they can make a difference in my life. That was really important to me. And to see that I just wanted to be them and be able to make a difference in someone's life.
And I think it's also important to educate your child on what neurofibromatosis is. Don't pretend it's not there, because they know that something is different about them. And if you're comfortable talking about it, they're going to be comfortable talking about it, and they're going to be able to speak up when people ask them, what is that, or why are you in pain, or why have you been out of school? You don't want to make it the focal point, but you want them to understand that there is something they deal with. So if there ever is any new symptoms that they're experiencing, they're able to voice that not only to you, but also to your doctor.
Teacher,
Yeah, teacher too.
right? Friends.
Yeah.
It's true.
Wonderful. I'm just going to ask one more question from the app. We have a few minutes. It's about FMLA, and this person asks, would one apply for FMLA once and it covers all future appointment leave requests, or would one fill it out for each time for a different request to take off time? How does that work?
So it's usually yearly, and it depends on what's filled out on the forms by the doctor. So I think that it does depend on what the doctor fills out. So, but yearly is definitely, I know that it needs to be filled out yearly for it to happen every year.
Mm-hmm.
Is it just, because I know that you can do it probably for different reasons also during the year, right? Because you can use it for yourself. You can use it for your child, your parents. So I think, do you know offhand if it's for different reasons also during the year?
No, I don't know that offhand. Would we?
Something new, you may
You can
use it
change
in
it,
your
right?
application. So if you have one condition, we sign, I'm the one who signs the form, so that's where I see it. Thank you. So if you have one set condition and you know in advance kind of what you need it for, you just fill it out and it needs to be updated once a year with a new signature and a new date. But if something changes, so let's say you have NF2 and you know you have an appointment every 4 months and that's what you first put in, but then you have a surgery and now you need 6 weeks off after the surgery, you would need an updated application to cover those 6 weeks. Because as Jennifer said, that the doctor originally probably put in 1 day every 3 months for your appointments and then they'll need to update it for your new surgery. So it can be updated with every new life event that might affect the time that you need off. Or if your child gets a diagnosis of something and you'll need time off, you can update it for that.
And then just to clarify, there's another question about how is this different than sick leave?
How what?
It's protected time off, so that's why it's different. Sick leave is not protected. FMLA is protected. It's a legal government-run benefit, medical benefit.
Thank you, guys.
Thank you.
Thank you.
Stand up.